Hello everyone, it's Irene, your ER nurse from Utah, and this week's Views from the ED, we focus on PPE, or personal protective equipment. Our tech Caleb is kind enough to show us how to properly put on PPE and properly take off PPE. And then we talk about mental health during these times. We have an interview with one of our social workers, Jenny, and she gives us some tips, and we just talk about it. How are you feeling during these times? And then at the end, we focus on this week's questions. It's so important to wear PPE properly when you're out and about or in the grocery stores. Here, Caleb demonstrates how to do it properly.
My name is Caleb. I'm a critical care tech here in the emergency department, and I'm going to show you how we put on our gloves and masks properly. We call it PPE, personal protective equipment. So first off, you always wash your hands is best. Hand sanitizer is also really good. So whichever is available in the moment, do that. So first, you're going to get your gloves on. I have mine laid out. And you slip them on. It's a little hard right after the hand sanitizer or washing your hands. But you slip them on. You try not to touch the outside too much, but once you have it on, it doesn't really matter because your hands are covered. Then for your mask, they might be a little different. Ours here, there's a white side and a blue side. You have to know that the white side goes on your face and the blue side goes out. There is a certain way to put them on. So you put it over your ears, you pull it up so it's under your jaw, and you squish it down. There's a little metal piece at the top, and you squish it down and mold it to your face. So that way it fits perfectly over the bridge of your nose and there's not hardly any gap at all. So you go about, you do your shopping, you do whatever it is that you're doing, and the first thing you do is you take your gloves and you pinch the bottom. You don't touch your skin, you just pinch the glove and you pull it off inside out. So now I have a clean hand and a gloved dirty hand. You kind of ball this up and you take one finger, you slip it under the inside. I haven't touched the outside, just the inside. So now my gloves are balled up inside out. I'm not touching anything dirty. Throw it away. When it's time for the mask, you just grab the loops back here, pull them off, pull it off, throw it away, and then wash your hands again just to be safe and nice and clean.
Thank you.
And that's it.
And what do you suggest when you have your mask and your gloves on in the grocery stores?
When you just gotta really make sure you're not touching your face. Your mask is gonna protect your nose and your mouth, but if you get stuff on your hands and you scratch your eye or you touch anywhere around here, all those germs are still ending up here. You're protected in some areas, but you're not protected in other areas. So just be conscious of where you're not protected and make sure you don't, do this or, anything like that, because it's not 100%.
Perfect. Thank you, Caleb.
Thanks.
So remember, guys, make sure when you're wearing your PPE in public, you're not touching your face, you're not touching your hair, you're not touching your mask, and after, wash your hands. So Caleb just showed you what you can use. We use similar equipment here in the ED, but we also add a gown. Sometimes we use additional equipment, which is called a PAPR, and Nikki's going to show you right now. So Nikki just washed her hands and she's putting on some gloves and she's getting all her equipment. That's her battery. She's gonna put that on the PAPR and check it. So we're checking the PAPR to make sure that there's proper pressure, and we have to make sure it goes all the way up, and we see the ball going all the way up. And Nikki likes to make sure she has the air going all the way up, so she's pressing it even higher for her. You can adjust it with those buttons. She's connecting the tubing to the mask. Now keep in mind these are already cleaned for us and ready to go. And now we're adjusting the belt on Nikki, and she's gonna put the Pepper hood on. She already has her hair in a hairnet. And now we're putting on that additional gown we talked about earlier. And she's putting new gloves on. And make sure that the gown is on tight. And there she is in her pepper. Our next clip is an interview I did with Jenny, who is one of our social workers in the ED, and we discussed mental health during the quarantine. Hi, this is Jenny, one of our social workers here in the ED, and I'm going to ask her some questions. One of them being especially with quarantine and basically people feeling sad, stressed about the unknown, because that's what it basically is. It's the unknown right now. What advice would you give to people feeling this way, the sadness, the stress, the anxiety, and what are important things they need to look at, or when do they need to seek help?
That is a really good question, Irene. I think one of the first things to realize is that there isn't a feeling that is bad. We don't have any bad emotions or bad feelings. And so when we experience something like sadness, anger, disappointment, anxiety, that we need to accept those feelings and not try to just brush them away and just pretend they're not there or think that maybe something is wrong with us. When things happen to us in our lives that we're not prepared for or that we haven't expected, that's bound to bring anxiety. Even good change brings anxiety, like starting school, beginning a new job, starting a new relationship that's a positive relationship. These are all things that are positive, yet they are changes and they can still bring anxiety. With the current status of the novel coronavirus 19, COVID-19, that nobody has experienced that, and I think that's one of the things that brings fear and that brings uncertainty. And in times like that, I think it's really important, a couple things that are helpful. One is to, when we're feeling anxious, when we're feeling, oh my goodness, are things going to get better, to just stop. And deep breathing is always something that we would recommend. With that, breathe in for 4 seconds, hold it for 4 seconds, breathe out for 4 seconds. We call it the 4x4. Also, a term that we use is grounding ourselves. And what that means is just stop where you are, take a look at what is around you, and name 3 or 4 things that you can identify that you see. Take time to listen and listen for things, whether it be a car driving down the road or somebody laughing or maybe a kid, being upset or something. And then basically we use our senses with the grounding. So we can touch 3 or 4 different things. We can use our smell, we can use our taste buds. We can do something that helps us distract from the moment. It's not going to take this thing away that's causing anxiety, but it's going to allow us time to distract and get a larger picture. One thing that's really important is not to isolate and to surround ourselves with people that we feel comfortable with, people that we don't necessarily have to be sharing our hearts with them, but just sitting next to, 6 feet away, sitting near somebody in your family, sitting in the same room, watching a TV show, doing something rather than isolating. What happens oftentimes when we isolate is that our thoughts can become unrealistic. We can dwell on negative thoughts, which really affects how we feel. And that's what a lot of people seem to be doing right now, is focusing on, oh my goodness, this is out of my control and I can't do anything about it. I have no control over this. And you're right, we don't. We have certain things that we can do in terms of, I like to call it physical distancing, social distancing as well, but we can still get together on the internet or messaging or on the phone, but physically distancing ourselves. But in terms of what we can do for the cure or whatnot, I think not worrying so much about that and remembering the hard things that we've overcome and the hard times that we've been through. And, they're saying that we haven't had something like this since really that's affected people globally since World War II. And that's something that I would say, people living right now haven't experienced, especially our teenagers and who are dealing with school from home and distancing from their friends and possibly not having, different things that they would be having at school right now, whether it be a dance or graduation or something. But rely on those that you trust and that love you. There's a 24/7 crisis line number that's the Utah crisis line. That number is staffed by crisis workers, by therapists, master's level therapists that are there 24/7 to answer any phone call.
Awesome.
That's 801-587-3000.
Okay.
Also,
and we'll put it in the link too.
That's great. That's good. And then also, we can download a simple app on our phone, and it's called the Save UT app. Standing for Utah, so the Save UT app, and that allows us to text these same crisis workers that we would be speaking with over the phone. And so those are a couple of really good resources.
And so what do we do? What do we need to look at where we need to seek help for?
That is a really good question, and there are really different levels of help. I think everybody could benefit from a therapist, an outpatient therapist. Lots of companies have what's called EAP, EAP employment assistance programs, and that's where your workplace allows so many therapy sessions without a copay. Okay. In terms of going to an ER to speak with a therapist and a crisis worker, the ER is open 24/7, and there is always a social worker, a crisis worker there available. The purpose of the role of a crisis worker in the emergency room is not so much therapy. It's to assess for those that are at imminent risk to themselves or to others. So if anybody is feeling like they might do something that they could regret, that they're feeling impulsive, they're feeling like they don't know that they could plan for safety, then that would be a good time for somebody to go to an ER to be assessed, to make sure that they are aware of the the continuum of services that are available. At times people have what we call suicidal ideation. Those are suicidal thoughts that they would be better off not living at this time. Those aren't a good thought. That's not a good thought to have. Mm-hmm. However, that is very different from having a plan as well as having intent. But sometimes it's just hard to sort out on your own, and so the ERs are open all the time. That could be a good starting point. You could also, if you do have insurance, call your insurance company and ask them for the address and the contact information for the therapists that are closest to them. There are also places that offer therapy at no cost or low cost for a patient for the first 5 or 6 sessions, such as cornerstone counseling. Okay. So that would be a good place to call as well. And it's important to share your feelings with somebody, and rather than thinking, I don't want to tell a friend or my parent or my spouse, those are really the people that are your first line of defense and that are
Great.
there for you no matter what. So please increase that line of communication, share your feelings, know that nobody is ever better off without you.
Awesome.
And things will get better.
Thank
Things
you.
will get better.
Thank you, Jenny.
You're welcome. Thanks, Irene.
I can't tell you how many times I've been laying awake at night just wondering, worried about what's going to happen because we really don't know. Make sure you call your family and friends, check on them from time to time, and lean on each other for support, now more than ever. This week we interviewed 10 people with our questions, and they are: how do you think our PPE here in Utah compares to the rest of the country? What do you like to do on your days off when you're on quarantine? And what do you suggest our viewers do when they're quarantined? Here in Utah right now, I think our PPE is sufficient. I know a lot of parts of the country, though, they're running out of PPE, and that's the big question. We haven't hit our peak yet, so I'm not quite there yet. So I don't know if we're going to run out. But as it stands right now, we have the proper amount of PPE available. But overall, in my hospital, I think we're good. On my days off, I like to play Animal Crossing. It keeps me entertained, and it just came out, so this is what's keeping me busy for a while. For my viewers here in Utah who are on quarantine and able to get around, it's been beautiful the past few days, so go out for a hike, go on a picnic. As long as you're 6 feet away from people, check out nature.
Hello, I'm Nikki.
All right,
I
Nikki.
don't know if you can see me through all of this.
This is our new
Our new face shields.
that they have implemented now this
Yes.
week. That's the new thing this week.
Got my Shrek ears.
Always changing, always changing. All right, Nikki, how do you think our PPE here, oops, I moved, compares to the PPE in the other countries?
Isn't that the question right now? Like, I feel like there's like online debates going on. Oh, is this airborne? Is it droplet? Here we're treating it like droplet. So I feel like for the most part I trust what's going on. I don't feel lied to. But then, you know, in certain, so it's just hard because in certain situations they say wear a PAPR or an N95, and then the rest of the time you're okay. So I'm just trying to do my best in just limiting how much I'm in these respiratory rooms and just doing my best to stay clean and healthy.
Awesome. What do you like to do when you're not at work and you're quarantining yourself? What keeps you busy?
My kids keep me busy.
What do you do with them?
I am.
What do you do to keep them occupied?
Well, there's lots of schoolwork, so we're still doing the whole homeschool thing right now, and that keeps them busy for an hour, because my oldest is in kindergarten, so she's just little, so we don't have a lot to do, but they love to ride their bikes. I've been making them weed the garden. we're out in our yard a lot.
So outside stuff too.
Yeah, outside stuff. The sidewalk chalk. Oh man, sidewalk chalk is gold right now.
Get sidewalk chalk for your kids. And what do you think people who on quarantine that are losing their minds? What do you think? What do you suggest for them to do? Keep them busy.
Oh, go outside. You know, stay
Within your
away-
little
stay away
area.
from other people, but like, I don't know, find just spend some time outside, even if it's just a walk to get your legs moving and get going. And I don't know where people are watching from, but I feel like in Utah the pollution's cleared up a little bit. It's really nice outside, like right now. You know, we've had our cold days, but yesterday was beautiful. I got off work just a little bit early yesterday, and me and my daughter went on a bike ride, and that was fun.
Awesome. Thank you, Nikki.
Yep.
Introduce yourself.
My name is Derek. I'm a CCT in the emergency department in Utah.
And how do you think our PPE here compares to the country or other countries?
Especially with other countries, I feel like our general PPE is quite a bit less. If you see Taiwan's response, they're in almost full hazmat like suits. But as far as the PAPRs go, I feel excellently or very comfortable in the PAPR and safe.
Okay. And so what do you like to do on your days off when you're on quarantine?
I play with my son.
Play with your son?
Yep.
Awesome. What should you tell the viewers to do? What suggestions do you have to keep them sane while they're in quarantine?
Get out for a run, but stay away from or practice good social distancing. And yeah, just make time for your family.
Awesome. Thank you, Derek.
Yep.
Hey, introduce yourself.
Hey, my name's Chad. I'm a doctor at an emergency department in Utah.
And Chad, how do you feel about our PPE as compared to other countries' PPE?
From what I've heard, I think we are fortunately much better off than a lot of places, although it could be a lot better. For example, I've been told this is the only mask I'm supposed to wear today, so could be better, but it could be a whole lot worse based off others' experiences.
And do you feel like we're covered up as well? I noticed, like, looking at other countries, some of them are super covered up. Do you feel okay with what we have?
I do. I'm more comfortable when I'm in the PAPR than this type of getup, but at least we're not cutting trash bags up and using them for gowns like some people are.
All right. And then what do you like to do on your quarantine when you're at home?
I like to tie flies because I do a lot of fly fishing when travel is more accessible. And I go for trail runs in places that are not crowded.
Awesome. What do you suggest to the viewers at home who are quarantined, that are losing their minds? What things can they do?
I would, take advantage of time spent with family, try to make some connections that you aren't able to do when you're more busy, and spend time outside in places that aren't crowded.
Awesome. Thank you, doctor.
You got it.
Hi, I'm Nikki. I'm an RN in the emergency department in Utah.
And Nikki, how do you think our PPE compares to our country or the world?
Currently, right now, I know in Utah, I'm comfortable with what we have, but when the surge hits, it's going to be comparable to every other country with the shortages. I do know that other countries that have had masks and have been wearing masks and had these face shields have had better success with the spread. So I feel like given the masks and the face shields that we have right now, we're going to be okay with our census that we currently have, but going forward, we are a little bit worried that we'll run out of our proper gear.
And what do you like to do when you're off in quarantine?
Sure. So I love being outside. So anytime I'm able to go hike when there aren't any other people around, we try to do that. We've been staying really busy with our new 9-week-old Australian Shepherd. So a lot of training and running around in the backyard. And then I also like to do personal programming and exercises, unique exercises for people at home, and kind of share that with my friends and family and social media.
Oh, maybe you can share it with us and I can post a link.
Yeah, I would love that.
Awesome. And then what do you suggest for people that are out there in quarantine right now, who's been in quarantine for a while, losing their minds?
Sure. I think we're all kind of there right now, but staying patient, practicing, deep breathing and meditation, and then make sure you stay outside, in your own backyard. If the weather's nice, getting outside can really boost your energy and kind of morale. I think at least it does for me. Reading books and then staying active, honestly.
Awesome. Thank you.
Oh, thank you.
Introduce yourself.
My name is Lindsay and I'm a critical care tech in the ER.
And how do you think our PPE compares to the country or the world?
Right now, I think we're doing okay. Hopefully it stays that way.
All right. And what do you like to do on your days off?
I do puzzles, color pictures, diamond paint, play video games.
All right. And what do you suggest to the viewers that are losing their minds at home who have been in quarantine for a while?
Read a good book. There's lots of books out there. Find puzzles. There's lots of different things you can do. Just try and stay home.
Awesome. Thank you, Linz.
Thank you.
Introduce yourself.
Hi, my name is Cassie. I'm a nurse practitioner in the emergency department.
And Cassie, how do you think our PPE compares to other countries?
I think it is very good. We have tons of PPE.
All right. How do you think it does with, like, if you've seen other countries, how they're covered, how do you think ours is compared to theirs?
Much better. I've heard that lots of places are using cloth masks, and I don't think that's good.
Awesome. And what do you like to do on your days when you're on quarantine?
I love to be outside. Try to be outside as much as possible, but staying 6 feet away from people.
All right. And what do you suggest to people who are in quarantine right now who are losing their minds? What things can they do?
I think you should clean your house, spring cleaning, make sure you get outside, cook yourself food. Obviously, Netflix.
Great. Awesome. Thank you. Yourself.
Hi, I'm Mari. I'm a nurse here in the ED in Utah.
And how do you think our PPE here compares to the country of the world?
I think we're doing okay. Some of the videos and stuff that I see in the foreign countries where they're doing full Tyvek suits in like hazmat, I don't think we're quite to that point yet, and I think that would be really, really hard to maintain staff because you can only stay in those outfits for so long because they get really, really hot. So you have to rotate a lot, and I really don't think that we could keep up with that. I feel really secure with the PPE that I'm provided right now, and with the guidance that we have. So I think we're doing okay.
Awesome. And what do you like to do on your days off when you're in quarantine?
I'd like to get out in my yard now that the weather's changed. I can sit on my patio and it makes it feel like you're not stuck in the house. I take my dogs for walks with social distancing, and I live really close to a park, and so it's kind of nice that I've got a pathway to go on. Try and get my husband up in the mountains as soon as the snow starts getting better. And, doing some movies, and I'm in school, so I do some online studying as well.
Awesome. And what do you have for suggestions to our viewers who have been on quarantine for a long time and losing their minds?
I'm kind of lucky. It's just me and my husband at home, but boy, with kids, you've just got to keep finding new activities, new learning, try and get them baking and doing stuff in the house. Plus, it's springtime, so get them doing some spring cleaning and give them projects that earn them extra activity time or screen time that's not just school.
Awesome. Thank you, Mari.
Yep.
Introduce yourself.
Hi, my name's Megan. I'm a doctor here in the ER.
And how do you think our PPE compares to other countries?
I think it's extremely variable between states and institutions, or among states and institutions. And I think that our institution is doing well, but I think some institutions are really hurting for PPE right now, and I think it makes a lot of providers feel uneasy. I think more emphasis was placed on contact precautions in other countries, and I think more airborne precautions, but we are doing the best we can with the resources we have available to us.
Awesome. And what do you like to do when you're off on your quarantine?
Oh, when I'm on my quarantine, I like to run in the mountains and bike in the mountains and read some good books.
Awesome. What about the people who have been on quarantine who may not have access to the mountains or anything? What do you suggest for them who are losing their minds at home right now?
I think there are lots of great online access videos that you can do to stay healthy. There are great workout videos. You can learn a new language. You can learn to dance. I think you can have great family discussions, really talk to your loved ones, make sure that you are reminding yourself to be present in your relationships, and use this time that maybe we're always craving when we are overworked in a normal weekday to really relax and make sure that we're enjoying the relationships that we have and really investing in the people around us.
Awesome. Thank you, doctor. Hi, introduce yourself.
Hello, my name is Gavin. I'm an ED nurse here in Utah.
And Gavin, how do you think our PPE compares to the rest of the country, world?
I don't know a ton of how they're doing in the rest of the world. I know New York's struggling right now. I feel like we are pretty stocked up on PPE gear at the moment as far as surgical masks go. Kind of a little stingy with N95 masks, and we probably honestly need a few more PAPRs to be safely equipped.
All right. And what do you like to do when you're off and you're on quarantine?
Spend as much time with my family as we can. We try and get out for daily walks. I have 2 little kiddos at home and a wife, so she's going stir crazy, so we get out for walks a little bit when I'm home. But I'm also in school, so I do a lot of schoolwork. So.
All right. And what do you suggest for the people who are at home, who've been in quarantine for a while, losing their minds? What activities or what things can they do?
I still think it's safe to go outside, so as long as you're social distancing, so get outside, enjoy the sunshine, enjoy some fresh air, go on walks, go on bike rides. When you're home, if you have kids, little activities, science projects, things like that to keep them busy.
Awesome. Thanks, Gavin.
Yep. See ya.
Introduce yourself.
Hi, Jason, one of the emergency room doctors here.
And Jason, how do you think our PPE compares to the rest of the country?
From what I've heard, it sounds like we're doing pretty well. You know, everyone's being fit tested for N95s. We have an ample supply of PAPRs and surgical masks. It seems like we have plenty of PPE now, so I would say we're doing a good job.
Awesome. And what do you like to do when you're off of work in quarantine?
What do I like to do? Eat, sleep, and watch Netflix. What have I been doing? Painting and doing silly house projects. Also running and a little bit of hiking. So.
Awesome. What about what do you suggest to the viewers who are already quarantined and losing their minds at home, bored?
What do I suggest that they do? Whatever they find enjoyment in. You know, I feel like there's a ton of stuff we can still do. We can still go outside, hike, walk around, get some sunshine. I think that's probably a good thing for everybody. It's just important to stay away from people and be responsible in how you do it. But that's what I would recommend. Just get outside, get some sun, get some exercise, and try and stay sane.
Awesome. Thank you.
Yeah.
Thank you for watching the show. Make sure that you're putting on proper PPE the right way and you're taking care of your mental health. And be sure to watch the end of the show for ways that we like to blow off steam in the ED. Did I do it right?
Yep. All right, so now...
You have proper PPE on that fits correctly, or else, I mean, you're gonna look like this and you're gonna look silly. But I mean,
it's Corona time. Hey, it's Corona time right now. It's Corona time.